Listen carefully, because what I'm about to share could fundamentally change how millions of Americans understand their Social Security benefits moving forward. A significant development has emerged from the Social Security Administration that affects retirement checks, disability payments, and supplemental income for seniors across the country. People are checking their bank accounts, refreshing their apps, and asking friends what they've heard, because something has shifted in how benefits are calculated. For years, advocates have been arguing that the standard cost of living adjustment formula doesn't accurately reflect what older Americans actually spend their money on. The government has been using an inflation measure based on wage earners, people who are still working full-time. But retirees spend their money very differently. They face higher costs for prescription medications, doctor visits, medical procedures, and long-term care. They spend more on utilities because they're home more often. Their housing costs, especially rent for those who don't own homes, have been climbing faster than the official numbers suggested. The disconnect has been frustrating for decades. Seniors watched their purchasing power slowly erode, while official reports claimed inflation was under control. They saw their grocery bills double while their checks barely moved. They faced impossible choices between medications and meals, between heating their homes and paying other bills. Disability recipients found themselves falling further behind, despite working their entire lives before becoming unable to continue. The formula simply wasn't capturing the reality of their daily expenses. Behind the scenes, pressure has been building. Organizations representing seniors and disabled Americans have been pushing hard for changes to how benefits are calculated. They compiled detailed reports showing the gap between official inflation measures and actual costs faced by beneficiaries. They documented cases of people skipping medications, rationing food, and falling into debt just trying to survive on fixed incomes. They presented evidence that the current system was failing the very people it was designed to protect. Recent economic data showed something troubling. Housing costs, grocery prices, and medical expenses were rising significantly faster than other categories of spending. This triggered renewed attention from policymakers and administrators who began reviewing the formulas with fresh urgency. Analysts compared real spending patterns of retirees against the outdated calculation method, and the results were impossible to ignore. The gap was wider than many had realized. For more than a decade, there have been discussions about switching to a different inflation measure, one specifically designed to track costs for older Americans. This alternative formula gives appropriate weight to healthcare, housing, and other expenses that dominate senior budgets. Every time advocates pushed for this change, they encountered resistance based on budget concerns and political complications. The trust fund projections, lawmakers argued, couldn't support such a shift without risking the long-term stability of the entire system. But something shifted recently. Updated financial projections showed slightly stronger revenue than previously expected. Nothing dramatic, but enough to create an opening for change. Senior advocacy groups seized the moment, arguing that beneficiaries had waited long enough and deserved a calculation method that reflected their actual cost of living. Key policymakers began meeting privately to discuss the mounting evidence of hardship among fixed-income Americans. What emerged from these discussions was agreement that adjustments were necessary. A comprehensive analysis revealed that older Americans were spending significantly more per year than official inflation numbers suggested. Benefits weren't keeping pace with reality. The purchasing power of Social Security checks was declining month by month, year by year. For millions of Americans, this meant constant financial stress, difficult compromises, and a steady erosion of their quality of life. The updated approach now factors in expenses that matter most to beneficiaries. Healthcare costs receive appropriate weight in the calculation. Housing expenses are properly accounted for. Medicare premiums, which consume a substantial portion of many seniors' budgets, are given their due consideration. This creates a more accurate measure of what it actually costs to live as an older American in today's economy. Based on analyses of the new methodology, the adjustment appears to fall in the range of 7 to 8% for most beneficiaries across different categories. The exact amount varies depending on individual circumstances, benefit type, and location, but represents a meaningful increase for people living on fixed incomes. This isn't a temporary bump that disappears next year. It's a permanent recalibration that resets the foundation for all future calculations. For someone receiving the average retirement benefit of around $1,540 monthly, this could mean an increase to approximately $1,660. That's roughly $120 more every month, or nearly $1,500 annually. For someone receiving disability benefits averaging about $1,358, the increase could bring monthly payments to around $1,465. That's over $100 more each month, making a real difference for people managing disabilities on limited resources. Supplemental Security income recipients, often living on the smallest benefit amounts, see adjustments to the maximum federal benefit levels. For individuals, this could mean moving from $943 to approximately $1,020 monthly. For couples, benefits could rise from $1,415 to around $1,530. These increases matter enormously for people surviving on less than $1,000 per month. Survivors' benefits, which support widows, widowers, and dependent children, also see increases under the same methodology. A surviving spouse receiving $1,360 could see payments rise to approximately $1,470. These beneficiaries are often among the most vulnerable, and the adjustment provides critical financial relief during already difficult circumstances. The timing of implementation is important. The new formula applies to upcoming payment cycles according to established schedules. Those who receive benefits on the second Wednesday will see adjustments on their next scheduled payment date. Supplemental Security income arrives on the first of each month. Disability and survivors' benefits follow the birth date-based schedule that has been standard for years. Everyone who qualifies will see the adjustment within the next payment cycle. Qualification is straightforward. If you receive Social Security retirement benefits, you automatically qualify. Disability recipients qualify. Supplemental Security income recipients qualify. Survivors and spousal benefit recipients qualify. There's no application process, no paperwork to complete, no additional steps required. The adjustment applies automatically to all current beneficiaries. Even those who recently applied and haven't received their first payment yet will have the new formula applied from the start. This change also affects future retirees. Anyone planning to begin receiving benefits in the coming months or years will have their initial benefit calculated using the updated methodology. This means starting benefits will be higher than they would have been under the previous system, providing better protection against inflation from day one. However, beneficiaries need to understand several important considerations. Higher benefits may push some people into taxable income ranges. The thresholds are $25,000 for individuals and $32,000 for married couples. Crossing these thresholds doesn't mean losing money, but it does mean a portion of benefits may become subject to income tax. Anyone with additional income from pensions, part-time work, or savings withdrawals should monitor their total income carefully. Medicare premiums may also adjust in response to benefit increases. Most beneficiaries will still come out ahead financially, but it's important to review Medicare statements carefully when they arrive. Premium increases should not eliminate the entire benefit raise. If that happens, there may be an error requiring immediate attention. Scammers are already exploiting confusion around these changes. Phone calls claiming to be from Social Security, demanding personal information or payment to process the increase, are completely fraudulent. The adjustment is automatic. Nobody needs to call anyone, pay any fees, or provide Social Security numbers over the phone. Anyone requesting such information is attempting theft or identity fraud. Looking forward, this updated formula creates a foundation for more accurate cost of living adjustments in future years. Benefits should track real expenses more closely, preventing the gradual erosion of purchasing power that has plagued the system for so long. Future retirees will start at higher baselines with better protection against rising costs throughout their retirement years. The most important action right now is simple awareness. Know your payment schedule, monitor your deposits, and document everything. Compare your current benefit amount to your next payment. Keep records of both figures. Save benefit statements and bank records showing the increase. This documentation protects you if any errors or discrepancies arise that need correction. These benefits represent decades of contributions and hard work. Every beneficiary earned these payments through years of employment, paying into the system with every paycheck. The adjustments reflect a more accurate accounting of what it costs to live with dignity in retirement or while managing disability. Stay informed, stay vigilant against scams, and understand that these changes aim to provide the security and stability that Social Security was always intended to deliver.